And the rest is pretty straightforward. Okay. Any questions on that before Cyril should be any moment so you can get started? Any other questions on the questionnaire? I can write the steps to automatically create a plot also. So I think you can even see the graphics. So that's what I'm working on. Then once you enter this, the difference before and after, and then you see a plot of the difference, like a diagram. So that'll be, more helpful for you.
Devendra, we can start anytime. Now I joined. So
very cool. All right, so I'll just add the equation, then I'll share it in a few days for you with you guys. So good, I'm going to stop and start again so I get the right one. Start sharing, and where is just 1 second. Bum, 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 bum. Now that you're ready, I've got to get my file. All right. So we'll be sharing this. All right, let's try that. Share. Can you see the slide? Anatomy of yoga. Oh, I think you can, right?
Yeah.
Perfect. Okay. And all right, so we're just going to go over anatomy of yoga poses. It's just a graphic way to remember. I think it'll be helpful for the muscles involved. So it's simplistic, but I think it might help. So when we do the ujjayi and all the ones that relate to sound, throat, then the glottis is what we're using. So voice box on the outside, but inside the glottis. The glottis is made of your vocal cords, so just tiny fibrous strands. All the sounds you make, these strands make everything, any sound you make. And these are supporting structures to help move it. These are the arytenoids. So you see how this is a bump here and a bump here. So these bumps are ones that move in and out. They rotate this arm in and out to make the cords move. So these bumps are operating the cords. So these bumps called arytenoids operate the cords, and the cords make all the sound. So this is a voice box, and when you big sound, small sound, so right here. And it's got a lot of nerves connecting to it. And one of the reasons probably so helpful is that it's connected to many areas of your brain. And, so when you're speaking, it'll be like this, closed. And when you're whispering, see that little bit opens. It's really quite clever, and only that bit opens. And when you're breathing out, like we do in our pranayams, and it opens wide like that. And then this is your relaxed position, and you can talk. So, right, and this is your lungs below, and these are trachea. It goes down to trachea into the left and right lungs, and then the sound comes from there. I mean, the force for the sound comes from there. And in Jainism, it's Pugdal, right? In Jainism, it's Vargna that are passed from that. Right, in the diaphragm, we look about diaphragm a lot. Very important to understand diaphragm. We've shown a little bit this before in the reflux study. So your diaphragm is big muscle in the middle of the chest. It's almost like a little bit of a dome shaped. It covers the liver, your spleen. It's kind of over that, and of course lungs are above, right? And your heart's up here. So the diaphragm covers that. And if you look at it from the top, it looks like this. So the diaphragm is attached to the wall, and then in the middle, you have all these nerves going through it. All these nerves that go up and down your bowel, will go to the diaphragm head spaces and allows them to go through. It also has your food pipe, the esophagus, which is right there. And it has your blood vessels going through it. This is the phrenic nerve that helps the diaphragm work. And then these crooks, these are the right crooks, lex crus of the diaphragm. These are like strands that go from the spinal cord. These strands surround your esophagus, the food pipe. So when you do diaphragm breathing, you are strengthening this muscle as well, and you can then control reflux. So this is why when you do the Kapal, bhati, and you do all the techniques we use to diaphragm breathing, the yoga breathing, if you do a lot, if you teach your kids a lot of reflux and you get them to strengthen the strength muscles with daily, couple times a day, then this will get stronger, and that stops liquid coming up. It'll still open up for food to go down, but because of tone, it'll stop it coming up. So you can actually treat reflux this way, so which we presented data for, and it's something even used in clinical practice. Okay. All right, it's related to other vessels. That's the diaphragm. And if you look on here, it's sort of attaches all the way to a lumbar spine, some of the strands of the muscle. So it's kind of really connected to your lumbar spine, which is at the back, and all the way up here. That's the diaphragm. Your rib cage, your neck, your voice box will be up here. This is your hip joints and your pelvis, which we'll talk about. And this is your spine going down. All right, so there's attachments of the muscle. So it attaches these places. And then we have obviously the, sorry, a little bit out of focus, apologize, probably a enlarged image. You have your brain. And we're not going to go too much in brain because it gets complicated. Basically, the brain is your gray matter, which is your neurons are white matter is connecting, and it's a different areas, hypothalamus, the areas we talked about. And this is at the back, the posterior fossa, they control your balance. And in there we have a vagal nerve. All the nerves we talk about are in there, and the pineal gland and the pituitary gland. And it serves right through, we call it sushumna, right? The spinal cord. It serves the spinal cord, all these organs. All the nerves come out from here. Some come out straight to the brain, but mostly all come out from the spinal cord. And so when we're doing visualization and energy here, and it comes up, we're kind of visualizing this and coming up to the light that we're looking at, or the color is coming up here. And you can imagine it's rejuvenating all this pathway up here. And I presume that the plexuses are where these are, when we talk about the chakras, they're where these are concentrated. And if you look at the anatomy, there's very, very parallel to anatomy, the concentrations in the chakras. So sometimes chakras do talk about the glands and sometimes the nerves, but nevertheless, there's a close relationship to them. Now the parasympathetic division, which is the one that we talked about, where you relax, right? Your left side, when you breathe in a left side, you engage your parasympathetic, and the right side sympathetic, right? So this is when in medical literature show pictures, they show as if the patient's looking at you. So this is the patient's right side, this is the left side. And in medicine, there's also slight right and left sided, just like we are taught in yoga, in Prakshadhyan. So when you are parasympathetic, your pupil contracts, whereas sympathetic, it dilates. So when you see somebody in the eyes widely dilated, if you imagine someone's angry, you see that. On drugs, drug addicts, you see that. The eyes dilated, then they're usually a little bit more sympathetic, and you may want to back down before they calm down, let's say, because you might provoke them, because that's usually your pupil dilated, and you're looking for, the flight or fright. So you're a little bit tense, and then you may not respond appropriately. And constricted is calmness. When you have parasympathetic, you will make fluid, liquid tears, and the tears will help keep you clean, moisten your eyes. and keep things in a restorative phase. But when you're in sympathetic, you're not going to waste that time because you're about to run, so you have no not that positive effect on the glands. It's just be neutral. And when you have make a lot of saliva, again, fluid, cleansing, moving, it's doing the right thing. Again, parasympathetic helps your salivary flow. And if you're sympathetic, then you have very weak, very little. It's just basic salivary flow. When you have parasympathetic, your heart it relaxes and your arterioles which supply the heart are dilated, so better flow and better fluid to the heart. Remember we talked about it, that everything's fluid is good. It takes the toxins out, puts the nutrients in. We want that fluid in and out. That flushing in and out is what we want at balance level. So it will do that. Whereas in sympathetic, it'll constrict them. It's going to make the heart work. It doesn't have time for that energy, so it'll make the heart work harder, but at the cost of less adequate flow. And so when you relax, then you can wash it off. So your body does that. So when you relax from your anxiety or stress, you relax, then it takes over and washes off the toxins. When you are parasympathetic, your lungs will constrict. So the airways will constrict, but they're like in their base range, not like asthma constricted, but they're a little bit constricted, but normal. And when it's sympathetic, you dilate because you want more oxygen comes. You're going to run, maybe you're going to run away, you're afraid, you may have to move very quickly. So you dilate them so it's more oxygen changing curve, but it's at a cost. When you dilate, it's at a cost. Then parasympathetic stimulates the stomach motility, secretion, the pancreas, getting everything, it's cleansing and digesting and moving things. It does all of that fluid work again. And if you're sympathetic, you got to stop that. Stop stomach, you cramp, you're dry, you secrete less, you won't make the juice as much, your glands won't work as much because you're saving energy and moving into different things. All right. And then when you're parasympathetic, your intestinal motility improves, which you want. You want the stool to move out, your fluid to go through properly. You contract your bladder to urine. It does all of that. And if you are sympathetic, you'll inhibit that. Constipation, less flow, and your bladder will not urinate, just hold it, because you don't want to pee, obviously, when you're running and trying to run from an animal or whatever we made for. So those are important factors. And it's not that one is better than the other, but generally in the world we live in, we're overly sympathetic. We need both, clearly. And the balance is what we're after. So you can see what works and how it works. Okay. And we talk about the other parts of the brain. We have the pons, the part of the brain deep somewhere between two ears, and the cord that comes out with all the gray matter information, the medulla oblongata, and then amongst there we have the start of where the vagal nerve starts, and the vagal nerve is very important in our yoga. And then you have a couple of different areas where nerves are originating and controls. And the nerves from the vagus go to your mouth, to your throat, as I mentioned, to your voice box. Other nerves go there also, not just these, but these go there. And then to your lungs, the heart, the lungs, and all the way down to the esophagus, the stomach, the liver. So it's sort of talking to the whole system. The vagus nerve is huge. All the way down to your small bowel, large, it's talking everywhere, right? And that's the communication we're engaging in. So when we are stressed or whatever, this is kind of, if you like, in a way, tense mode. And a lot of what we do is to control this and relax it. And all these things get relaxed. And based on visualization, we can direct these nerves to be active, these to be active. And that's kind of what we're doing when we're trying to say where the pain is, focusing on pain, where we're trying to get the vagus nerve there to allow better functioning and cleanse that area and reduce the pain. So this is the vagal nerve. We've seen it in many different forms. Then we'll do some of the poses. Okay, so that's kind of your pranayama and your breathing exercise and how they would help. Now in the upward dog, which is a little bit like your cobra, but just an extension version of that. You will use these muscles, right? The triceps, spinal extensors, and the glutes. We talk about gluteus maximus name, but we use colloquial word glutes, the hamstrings, and the lateral muscle, laterally. So, and of course, you're stretching your neck. So this particularly is the upper dog. We didn't quite do the pose, but it's not so far away from the cobra, except just a bit more. So these muscles are activated, if you like Anuja used the word activated, which means is we are straining and stressing them, and they're very good. So imagine if I pull those muscles, how my spine will straighten and not get bent over like we get with age. So those are muscles that work. And then if you look at the other way, the diaphragm is also working. So this is the image from before. And then you get the psoas muscle, which is down in a very strong muscle in front of your spine. And the one that attaches to your pelvis called iliacus. You're engaging all those very strong muscles in the front of your spine. Back and front spine have very strong muscles, right? And then based on how you're holding your legs, you're using the pull muscles to keep your legs together rather than wide, right? So all these muscles are going to play. So it's not just poses and relaxation, you're actually working on the muscles and hence muscle strength to some extent. Okay, the downward dog then, opposite, what would that show? Well, this one works on the gastrocnemius. This is the one that very close to what people call psoas muscle, but there's a new trend, but I don't think it's just a trend where because it burns glucose well, people recommend that to reduce your blood sugar after you eat. Hamstrings, the glutes we talked about, and these muscles at the back, the very strong muscle at the back that you all know where you have a scapula and you have this muscle at the back that you see people have muscles to the spine and up to the shoulder and the side. That is a lat, so latissimus dorsi. And the deltoid is the one that goes from there to the shoulder muscle. So all these are activated, but it's still considered relaxing pose because you're not straining them. They're just activated, but then they're stable. So this is considered a relaxation, a relaxing pose because of that. Of course, sometimes the ankle strain, you may find it difficult, but if you do a good job and have your feet flat, then at some point you get a time where you'll feel that relaxing as it's a very stable pose. If the flip side, you can see the interesting foot muscles because you're going to hold them. They're, activated. Your quadriceps, which are your muscles in the front of your thigh, right? And the quads, because you've got to stay up. These are the ones here. And then you have this serratus, other muscle in your rib cage, which is the front of the rib cage. You have these at the back, the front, and your triceps in your arm. So you activate all those muscles. Okay, a lot going on there. People go to the gym, you see all these plots, all these images and what you're working out, and when you do weights, this does it. Of course, it won't build weights the same muscle the same way, but it's very helpful. Because if you hold the pose, you may get benefits in that sort of degree. And the prone backward, or one of the boats, not the boats, the prone backward is fine. It's I think very close to locus. You see the triceps, the erector spinae, the glute, hamstring, and soleus. Soleus is the one we talked about with the gastrocnemius. This is the one that's particularly good at burning your glucose after you eat. So if you activate that, in Vajrasana does it, but any which way, then your blood sugar can be controlled. So you're diabetics, you can work on that. But be very careful when you do anything with diabetics. Make sure what they're on, the medicines, and their doctor's aware, because you don't want to change sugars and here and there sometimes. You want to do it consistently. So you'll be very careful. Pre-diabetics, anything you want, but diabetics, be very careful. And then the bow, right? So in the bow, you've now pulling your glutes. These are your chest muscles that you want to open up. So remember, you're a little depressed and you huddled down. These are muscles we have to stretch out and you feel open, and the openness makes you feel better. And these are the pectorals, the very, very strong muscles. And then you have these other muscles that are in the leg that we didn't quite talk about, the adductor and smaller muscles that help support your thigh. And then if you flip over and look at the arm, then carefully you can see the arm, your forearm muscles are all inactivated. pronator in there. So you've got a lot of benefits there. The bow, okay. And then the cobra, which is, we had the other, but very similar. So you got the serratus, so slightly different just because of the way the hands are held, but the rest is very similar. Your triceps, the glutes, and the hamstrings, right? And you are probably using some of the pectorals, those not mentioned here, but you are opening your chest a little bit and straightening your back. So you probably have some other benefits, but these are the major ones. And then with the fish pose, very good pose as we heard for the lungs, but also thyroid. And your lungs, you breathe your lungs directly open, so it opens your lungs up, and you're broadening your chest. Here, you're not using the pectorals to pull; they're just being pulled because of your posture, so they're actually relaxed. But your abdominal muscles are really good. So your rectus, so your flat bed, your flat tummy you want, this is going to help with that. And of course, your diaphragm is operational. So this is your fish pose. And this important one, this is one that helps your clavicles and helps your lung. Your lung has three phases of breathing. The breathing up with the clavicle breathing, it helps, and it's an important muscle for your neck. Okay, and then we have the couple of poses which I think we sort of more or less do. Some versions we do. So ear to knee, kind of, it's more like a position you get into. We don't normally do that, but in the plow, if you do the plow fully, you get close to it. Now, the plow, the legs are straight. They're not bent like that, but it's very much like the plow. And so you get these other muscles involved, the rhomboids, trapezius, the erector spinous, so you got other muscles involved that can help. Okay, and then when we do this shoulder stand, one of the key things we're doing is we're letting the lymphatics drain. So lymphatics move more with gravity. There's not a pump. Your arteries and veins have pumping mechanisms. The artery from the heart, the veins from your muscles generally. But the lymphatics, they take all the debris between the artery and the vein kind of communication and leaks out tissue, and then what's left, it comes up in lymphatics. So when you do this, you get all that dead cells and decayed cells and tissue and recycling material come all the way back, and it goes back and goes to the heart and rejoins your circulation. So one of the advantages of doing the shoulder stand, amongst other things which we heard about with the neck and the thyroid and the brain and blood flow in the heart and what have you, is this lymphatic drainage. Very important. And if you note, as people get older, their legs swell. Well, they swell not just from the veins; they swell from lymphatics also. And if you did this, you probably won't get that leg swelling, and even the plane won't swell as much if you keep these very healthy. Lymphatics are very, very important for immune function, that your immune cells go through that very important system. Some people feel that the meridians may be from lymphatics, though I'm not quite sure it's not shown, but some of the chi, what have you, is to do with lymphatics. The Chinese chi, the meridians that even in Ayurveda you have some meridians that thought to be lymphatics. All right, so again, shoulder supported. So when you do a slightly variant version when the shoulder supported, you can see how your bowel flops down, which helps the bowel take a rest and invert, so which is helpful. Because anything moves bowel, things will move forward, and then forward will move forward some more. Because of motility, the bowel won't go backwards. You won't reflux because the bowel has very strong motility and protection for you to reflux. Unless you just eaten a big meal, then you shouldn't do that. But otherwise, it protects you very, very well. And you can see how this works and which muscles. Again, different muscles, right? Trapezius, your rhomboids, posterior, all the back muscles come to play, which is very important. Okay. And then here we'll see an inhalation and exhalation as we do this bridge. What we'll see is the two-legged table, if you like, or many terms for that, but this is from a book, so they've used this term. The tibialis, which is the one at the front of your foot, is activated. Your hamstrings are activated, which another pose also does it. So that's helpful. And then you have quadriceps, which we talked about, right? The deltoids is heel. And when you relax, of course, everything's relaxed. So up and down, this is a good one. And then the bridge, so that's the table is the bridge. Again, your rectus, which is the one that the belly people want, the models want, that's rectus, that gets strained. That massages your bowel and your organs, your small bowel and large bowel. And the glutes, hamstrings, and quadriceps help stabilize, and that's where your strain is. And your hand can raise it up, of course. And of course, you'll have some hand muscles used, but it's what the pose is trying to do that this picture is trying to indicate. Okay. Very nice. And then, of course, with the, this is more straightforward. We're going to try and pass the wind, the Pawan Muktasan. So in this one, we will compress, which is more straightforward. All the organs here are going to get compressed, right? And you're going to use also your arms, your triceps, deltoid, they all get involved. So pulling, and that pressure here with the quads and will help massage your belly. And of course, your angle. When you do that, your anal angle goes up, which allows gas to pass. And you rock, then you can massage it some more, so you can see how that works. And then the lion, or the sound. So again, you're going to use these muscles. We don't use very often, but the neck muscle you can strain, you use those, and they're oxygenated as well. Your tongue, of course, has a lot of muscles, so you're going to activate your tongue. Tongue has a lot of areas that relate to your brain, just like your thumb. So keeping your tongue healthy is a good thing because it has many, many areas that seem to represent your organs and your brain also, just like our thumb or other parts that we know. So, and on exercise, the tongue is a very important thing to do. It's a big organ, in a sense. There's a lot of blood flow and a lot of vascularity. And we already know the vagal nerve goes there. And it has these bones, the mandible and the hyoid, which seem to help the tongue bridge itself and do its work. Okay. And then when you do that, you're helping the TMJ. TMJ joint is important because it's a disease. We can cover it because we only have to cover so much. But TMJ joint dislocation and problems are very common. And when they are affected, you get headaches. It's a very annoying condition. Headaches even affect blood vessels going past. It can be quite a serious condition. And if you keep doing this, your TMJ joint will be in play and supple and moist. Right. So these joints are very important. So this is a good one to be familiar with. Vajrasan, okay, so we already know which happens is mostly a resting pose. So you're resting everything, your joints, your spine, and all these things are relaxing. So you can see how it can be so relaxing. Americans, and just because I've been a little bit more west, I have a tough time sitting like this. I'm still working on it. So as Anuja mentioned, for Americans, this can be difficult because it's not a pose they've ever used in their life culturally. And so when they get to it, it's very difficult. But perhaps with time, they can get there. But if you can get there, your spine is straight. It's a perfect, many benefits. And then when you're moving in and out of it, you're going to squeeze your soleus, which is here. And so this could be a way that could help after meal. Another reason why you're burning your fuel, your glucose. The twist. So we talked about the twist, smile twist. And if you look at top fin, you're going to, again, use a sternocleidomastoid, the one that helps control your clavicles up here. You're going to activate that muscle. What's also important is that your lower muscles, which is the ones which are genital, the ones that help you with your control, your continence, right? And suppleness of your pelvis, we activate those. And there are quite annoying conditions if they don't work. Chronic conditions, miserable conditions if they don't work. So this is a good way to keep those going. Right. Of course, some of the muscles involved we talk about, these are important ones. Very few things will get those muscles going. Very important muscles, a lot of benefits. And we feel when you do the band here, we get more strength, and this is the muscles you'll be using. And in the back here, you have the rhomboids again, which helps your scapula move together, the wings. And of course, we know that's very important shoulder movement and activity. And then these are other spine muscles that this activates, erector spinae, which are more twisting rather than the latissimus, which is the strength. So you get those activated. So you're acting all those muscles. All right. Then the forward bending, sitting kind of thing. Of course, you can imagine which muscles are in the gastrocnemius, which is a very important calf muscle next to the soleus, but this is a stronger one. Hamstrings, glutes, and the spinal ones. And of course, if you can do this, that's great. You get a lot of other benefits. You're compressing the bowel and the abdominal organs, so you get all those benefits. And of course, your neck, you're bending your neck forward, and keeping your neck supple. And when you look at the flip side, and you look at the image from the bottom end, you'll see in the feet, your plantars, this your feet, they're getting a little bit of massage or break and movement, Achilles tendon, then the gastrocnemius, the hamstrings, and then your spina that we talked about, the erector spina. And then it can all the way down to the scalp fascia, because you're doing this, it pull on your scalp and you're kind of massaging your scalp. So it's a very, very useful one for those muscles, difficult to correct. Then we learned the squat just recently. We just did that with Anujaji. And these squats are very helpful because, of course, there's a little bit of issue with the heart, lungs, and you can use your diaphragm, right? But importantly, the other muscles that it's using, which are the small muscles in the foot, are coming to play, right? And if you keep working, imagine if you keep doing this, how unlikely you can get plantar fasciitis. So you're keeping this working. These muscles are usually where something goes wrong. And the levator ani, this is one again which related to the other muscle we showed you, which you can close and control. And your band here, when you do your band here, this is what you'll be using. This is your diaphragm, which is in play up here. You can see down here, it's the diaphragm in place. So it'll help you with your reflux and build the diaphragm strength. And then these smaller muscles, which are important to stabilize your hip with the spine, they get activated. Quadratus and lumbricals. So it's very important to think to this in other sense. And then we did the warriors. The warrior one, again, glute, semitendinosus, another muscle that nothing else does, and grasses, another smaller muscle that stabilizes the knee. Very important because small muscles have a big role in keeping your knee stable. Big muscles are important and strong, but small ones that keep just adjusting it and stabilizing it, right? And then if you look at front, your deltoid, the pectoralis, the lung, even the smaller lung muscles, the chest muscles get activated here. Your abdominal muscles, the psoas at the back, which is a very, very strong muscle, important to activate. And then you go down to your anterior ones, the rectus ones, bastards. Again, these are the quads, but they're different parts of the quads are activated. And of course, down leg. So it's putting in a chunk of new muscles that others are perhaps less so. And the tree does many things. One of the foremost things it does, it stabilizes so you get more stability and balance. And that's at the back of your brain. So the back of brain has proprioception nerves there are telling your brain the positioning and balance. And so your back of the brain little area that we showed earlier, very important. That's one of the first things that goes when you age. And the cells that control are the first ones that go. So when people age, they feel okay because they can have the same strength move. They start stumbling and falling because they didn't recognize that this is not working. It doesn't affect your strength or movement, it affects your stability and your balance. So it's very important. The moment you're about mid-40s or above, you should start working on this earlier because the balance is one of the things that goes. That's why people fall and break their. Why do people break their thigh muscles all the time, the femurs? As age, because the balance is gone. If the balance, even they trip up, they'll be able to somehow balance and not fall in a way that protects them. But because the balance is gone, they just fall and it breaks, and the femur breaks, which is a very nasty outcome, as you can tell, as you know probably from experience. Good. So now it's in the other psoas, the psoas minor, right? Which is psoas major, the big one. This is minor. It picks up iliacus, which is, again, only if you like butterfly can do that also. And it picks up your other muscle adductors, the sartorius. Another one also earlier, the warrior one picked that up. And then, of course, quads we know. The crassus we talked about before. And then the anterior tibial muscles and the gastrus and soleus. It picks all them up, right? And in the back, you'll see adductors. So don't remember the names, but what I'm trying to indicate is how much this engages and how much is going to help if you work to all these muscles, perhaps, to keep them all engaged. They all have important roles in their own way, and all of them will give you severe problems if they don't work. All of them. For bend, then it has spinal extensors, so your spine is going to get stretched, which you want. And these extensors are engaging, which is very important because if they work, they'll keep your spine stretched, and they'll stretch you and keep it supple. The small muscles are very powerful. They add up. Your diaphragm, of course, is going to be engaged because you're bending over and you're breathing more diaphragm breathing. Your psoas muscles, major, which is a big one. Glutes, we talked about hamstrings, we talked about the quads and the leg muscles. And then if you go all the way down, you get slightly more involvement of your piriformis sinus than the other one. So there's a benefit of doing your pose the correct way all the way down, even if you get benefit this way, and if you can do this, which all I can do probably. If you straighten your knees and bend over more and get to this, you get further benefits. So it's not just stretching, flexibility, you actually get additional benefits. So it's worthwhile. These are the aerial views of that, and you can see activation of these enzymes, these muscles. The biceps, semitendinous, piriformis, a lot of muscles get engaged. Okay. And then the Trikonasana, slightly different version back and forward. So, but basically it's one that we practiced. And you can see the benefit of the muscles again. But here you're twisting the spine. And as Samaji even teaches, when you twist the spine back and forth, even when you do the supine spinal twist, let's say, that twisting spine back and forth seems to help get reset itself. So when you have back issues and the twisting is, again, check your doctor, make sure that your patient is safe to do that. But that twisting motion helps reset your spine and your spinous processes and your vertebra and the disc. So this is a very important one. And the whole spine can only twist 5 degrees itself. We're twisting around here, but the spine is only twisting to 5 degrees. But that 5 degrees is very important. Okay. And a lateral, which is another version of the same thing. You see subtle changes in the front muscles. Similar thing. And then the Tadasana, which is one form of the Tadasana. You can see which muscles get activated. Okay. We do a cat-cow, so we kind of assess that, primary and secondary curves. So the curves are important. You're getting curves, 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 curves. So you can imagine the spine, the muscles involved. And they help obviously keep your spine supple and all the other organs we talked about. In the child pose, which is a primary curve. So this is called a primary curve because this primary, the big muscles are used. And it's very relaxing. We already know it's very relaxing. We will experience that. And you're compressing abdomen. So this is a primary curve. And then we do the spine flexion, which we do as a pre-exercise. And of course, this could be one of the poses. Yeah, half moon. And this degree of spine twisting is important. The more you can do it, the healthier it is. And more flexible it'll achieve better goals. And you do upper knee, then you spin. When we do the upper neck, we fix those. Then we do the whole body, we fix those. And then we go further and pull weight. We go all the way down. So this is what we're doing. Fine. And then the backward and forward flexion, when you go back foot, like when you do in Surya Namaskar, this is what you're doing. You can of course do it in the camel pose, but even Surya Namaskar, Ramashi teaches we that at the beginning, as far as your back. So this back and forth keeps the spine moving, and the spine moves in this direction and keeps it supple. And this is the range of motion that you can get. Okay, Ujjayi. So the glottis we talked about. These muscles are stabilizing us, very important. And this is with and without breath. Without breath and with the breath. It supports in this angle we see. And I think I should be at the end. So anyway, these are the pictures. Some are just so you're aware. What I wanted to impress on you, which is that the muscles that you use, if you do a range of the yoga pose that we taught, are going to cover your whole body. And you're going to activate even small important muscles, oxygenate them. You're going to keep them fit and free of toxins and lactate, and they'll be able to absorb you. So I think if you're physically swasth and you keep your body supple, they can help you with your spiritual journey. So this is not to belittle, it's actually important. I think it's something we have to do. You have to look after your body and keep it swasth so that we can do things. So it's a step towards our goal. And the other benefits are your bones will be healthier, because whenever you activate muscles, you pull on the bone makes the bone get healthy and lay down more bone. So you always support your bones, so your fractures become less likely. So we call this muscle to bone. The bone actually grows not just gravity, but also muscle pulling. So you're going to keep your bones healthy by doing this. And again, we didn't do any weights, right? It's your body. Just imagine how powerful this is without any weights in the gym. There's some people believe that weights, a little bit of weights are okay, but you try and just build muscle with weights, you're going to get problems later with the joint. So there are people who are not sure that gym is the right way to go, even though it looks good. You want to do a little lightweight perhaps, but this is definitely a much better way. And serves our needs. Okay. Any questions? Anything we will go over? Of course, some of the posts is PowerPoints, you'll have it available. I have the book, so I can show it to you. I do have the book, so it's going to be okay to show it to you. All right.
Yeah, this is wonderful, and now it makes more sense when we do the poses. This is very nice. Thank you.
No worries. And I think it's, even if you're not going to memorize all of it, we'll see how much we'll cover in the exam, let's say. And some of you will have questions, I think. But more importantly, is imagining when you're doing this, all these muscles are being used, right? And then now, if you have somebody with a specific disorder, you can go back to this map and say, you know what, maybe I have to work on this process for you. So you could use this to kind of guide you to kind of spend some extra moments, or do 10 of those and 3 of the others. You could use this. And over time you get very confident with this. And this book I have is very useful. It's more next level, but you already understand it, so I think it'll be a good resource. And I can reference the book if you want to get it. Also very helpful, I think.
Yes,
very well done. Very well done.
Sounds good. Thank you.
Any other questions? Anybody else? We started 10 minutes late because of the Owen, so I apologize, but we should have leave time for the yoga poses. So if nobody's any questions, maybe I'll let Swamiji and we can proceed with the yoga poses.
No, nice poses. Sees the exact dimension, how it works. In every angle you can see your body is moving, how it moves.
So if one particular muscle is hurting, say you mentioned about the hip bone, and like females get hip fracture, are they all connected in some way where if one is compromised, the other muscles compensate for it, or?
Yeah, I mean, I think if you're sitting a lot, already some muscle not going to be there, and it's not the muscle, the ligaments also get stiff, not just the muscles. Obviously the joint gets stiff, ligaments to the joint, the tendons to the joint, and then the muscle. But if I'm not using certain muscles that are coming from my bone, all the muscles come from the bone, right? They're attached to a bone somewhere. Then that bone's not getting pulled and not getting worked. That bone's going to decay, right? So two problems. One is that's the bigger problem. They fracture, you fall. When you fall, the muscle is strong to support your fall and balance you because it's too weak. So you collapse in an ugly way rather than like a young person way, right? So your clumsy fall, the same fall, if you're 10 years younger, you fall in a different way because your muscles are there to kind of support and balance and cushion. But as you age and you don't do that properly, then you're going to fall and there's nothing supporting it, less, and it'll fracture. Once an area doesn't work, other places have to compensate, because don't forget your muscles like many joints. Your foot. So if your ankle doesn't work, your knee has to compensate, and your toe bones have to compensate. Then they'll get fatigued faster, more weight and strain on them than they used to. Now you can hurt the other bone because other bones taking more strain than it should. The muscles, of course, going to try and help, but you probably don't have the muscle in the first place, and now you're going to strain that joint. And the way the joint is compensated is not natural. It's compensated in a funny way to compensate for your hip. Your knee is not working. Your hip is compensated in a certain way. You walk in a funny way. Your back is in front, so you take the weight off. So now your back's going to be chronically forward, which means the different muscles are pulling all the time rather than balancing. So now your back's going to go, right? So this is the problem. So you're all connected and they're all interplay. So if you don't keep it supple, it's just a matter of time it's going to happen. There's no question it's going to happen. And I think this is one of the issues of us not learning yoga early in our life. We just missed in education. The Western influence has destroyed it. Went out of school curriculum. It's more an adjunct, and if you want to, with the stigma. And we did sports, which are not very helpful in a global sense. They help a little bit, but I do one sport and helps that, doesn't help the other one. Yoga does everything. So we ran from yoga to the westernized biases, and we lost a lot of ground, and we become like them, we fall like them, break bones like them, right? So it's a bit of a shame. Bit of a shame. Okay.
So thank you, Dr. Devendra. You have explained very well the anatomy and the physiology and how the yoga poses are affecting different parts, muscles, bones, etc. With very clear pictures. So now everybody has understood how yoga is important for us to fix our physical problems and issues or any kind of pains or problems in the body. So thank you very much for all the excellent talks. Now, this is the time we have to practice our yoga techniques. And we have started physical exercise or poses, you can say. So who is ready for today to give yes, so Dinesh is ready. You are welcome to show the yoga poses.
Jai Jinendra, everyone. Mandavinam Sami Samiji. I have a little challenge here to set up my camera. I'll try my best. Sure, how visible I am here. I doubt that you'll be able to see me clearly, while I'm doing the poses. I don't have enough space here. Let's see. Yeah, camera focus is so big,
So that's the autofocus. You should be able to stop. I just
it's focusing on me, the camera is adjusting.
There's a feature but I can't find it. The feature with Sachi's on, she showed me, but there's a feature where you can turn it off. It's actually not difficult. You've got to find it.
Yeah, if you go on videos, right, and then you do this, the video settings, click on a video settings. I'm doing with my, and over there are the 3 settings. Okay, adjust for low light, you can always be keeping, but the auto framing you can turn it off. So this will become under the appearance one. Under appearance one, so there is a auto framing. You can these things turn it off. And if you also want, that they will not adjust, then you can also turn off touch up my appearance.
You want me to turn off the touch of my appearance?
Yes, because that's why if you are going up and down, then it will be not, the affect. They will try to more on focus side one, so that's why you can just turn those things off.
See if it improves. It's a little better. Can you guys see me okay?
Yes.
All right. So, Nami, I'll be doing, camel pose, which is Ustrasana. That's the Sanskrit name. The key benefits of camel pose, the Ustrasana, it opens up your chest and your shoulders as well. It improves your posture, your spine. It strengthens your muscles, and of course the digestive system, because when we bend, we get some massage on your abdomen. Precautions: if you have any lower back problem, any shoulder, neck injury, we should not attempt this pose. And then if you have heart problem, high blood pressure, then you should not be, doing this pose. So those are the benefits and precautions. Now let me see if I can. Just want to make sure that. All right. So we'll start in the Vajrasana. We'll sit in the Vajrasana. Make sure your spine, your neck, your head is straight. Then you get into a kneeling position on your knees. Your hands by your body and then your fingers pointing down. And there is a small gap in between, which is, hip width apart. Your knees needs to be hip width apart here, maybe half a feet. Inhale, and you open your chest. Go back so you can see me. So you are in a kneeling position. Your arms are straight, fingers pointing down. Your thighs are, perpendicular to the floor. You inhale and you open your chest. Now exhale, you push your hip forward. Keep your neck long. Then slowly move your hand, touching the ankle, one hand at a time. Use the other hand, touching your ankle. Slowly bend your neck. Again, do not force yourself. Listen to your body. You try as much as you can. You can move down. Stay there for 3 to 5 breaths. Breathe normal. When you're done, slowly come up. Bring your hand to your lower back. And then just sit down and then relax. And you get back into your Vajrasana again. So that was the camel pose, Ustrasana.
It is
Any questions?
it is Ustrasana. Ustra.
Ushta, sure, right? There is a sure, right?
Sha,
Ushta.
tra. Trump ka tra.
Ushta, okay. And there is a half show as well, right? In that one?
Correct.
Half
Yeah,
show.
it is true. It is true. That is
Yeah.
correct.
Ushta.
It is Ustrasana.
Ustrasana, yeah.
Trump.
Thank you, Vandana.
Yes.
Any other questions on that one?
Anybody has any question?
No, I think it was great. I think the way it came out was good. Also, be careful how you come out of the pose. So that was good.
Thank you. The second pose, Vandami, I'll be doing is bow pose. And of course, Dr. Devendra talked about, all these stuffs, how it helps us, overall physically and the different, benefits of doing this in today's presentation. So bow pose, again, this is the Sanskrit name is Dhanurasana.
Correct.
Like a dhanu, like a bow, which is like a bow shape, right? Dhanush. It's a dhanush.
Yes.
In the bow pose, the key benefits, it strengthen your entire back. It again opens up the chest and of course shoulders. It also improves your digestive system because it massages your abdomen, and of course, it helps in the flexibility of your spines, your spine. So these are the key benefits of Dhanurasana, bow pose. Cautions, again, same. If you have any heart surgery, if you have any neck, shoulder, if you have lower back pain, if you have any kind of high blood pressure, heart problem, shoulder, neck, back injury, do not attempt to do this pose. Then I'll just demonstrate. Let me see if it's visible properly.
Can you do it sideways?
Sideways.
Yeah, this way. Then we can see.
This way.
That way, yeah.
You also want me to try the first pose again, the camel pose again?
This is fine.
Am I visible now?
Yep.
But the only problem I have is, I won't be able to, lie down here because I have very less space. I'll try, maybe going angle here.
Yeah, angle will work very well. I would suggest angle.
Angle will be okay. Sorry about that. I'll try my best. Are you able to see me?
Yep.
Let me see my camera properly.
Yeah, that's better.
Perfect.
So lie down on your stomach. We are doing the Dhanurasana, bow pose. Chin touching the ground. Hands are straight. It is facing down, palms facing down. Keep your body straight, your legs straight. So one thing you can do before you do the bow is you can practice moving your legs, bending your knees, trying to touch your buttocks, both, one by one, because we'll be bending our knees in this pose. So normally you can massage, but keep your head, chin touching the floor. Then you inhale and bend your knees, maybe in 90, angle of 90. Then on exhale, you try to reach out to hold the ankle or the feet here. So inhale, bend the knees, exhale, and move. You can just, kick. In fact, if you want to, you can kick your knees so you can hold it with your hands. So exhale, and then slowly lift your shoulder and thighs at the same time. Exhale, slowly, very gently. You try as much as you can. I hope you can see. Keep your head straight, gazing forward. Stay there for 3 to 5 breaths. Breathe normal. Slow. Release. Then relax. Slowly come out of the position using your hands. So that was the bow pose, Dhanurasana.
Very nice.
Yeah. Any questions?
I think it can also help with thyroid when you're stretching your neck.
Yes, absolutely, yes. Thank you. So do I have time to show one more pose? I'm okay. I can do shoulder stand,
Okay,
Sarvangas.
that will be good. It is
Thank you
not
very much.
easy for everybody.
All right.
Yeah.
So in Sarvangasana, which is shoulder stand, key benefits. It stimulates your thyroid, your parathyroid, because when we do Sarvangasana, in Sarvangasana, we touch our chin to the chest. So it stimulates your thyroids and parathyroid. It helps circulate and venous return as well. It calms your nervous system, and it also relieves some anxiety you have. And of course, it strengthens your shoulders and your core as well when you do Sarvangasana. All right, so I will go and I'll see how. See. So we are doing Sarvangasana. In Sarvangasana, you have to lie down on your back. Hope you all can hear me.
Yeah, we can hear you.
All right. So lie down on your back, your head, your spine, everything is straight. We're looking up, hands, straight, pointing down, palms facing down. This is important in Sarvangasanas because we'll be using our palms to push our body. So the first thing, again, the same I do in this pose as well. I do some relaxing, or I would say, stretching exercise here. So that way, when I bend my legs, they come in 90 degree. So I try, one leg at a time. I do some stretching. And then you inhale and bend your, legs in 90 degree. Keep your head straight, don't bend it. Then with the help of your palm, you have to force downward so you can lift your body up. One thing I missed to mention about the props, in Sarvangasana, you can use wall as a props. It is very important. And the other thing you can use is maybe a small soft towel or a small pillow. You can keep it under the neck here, so you can avoid neck injuries. When you go to this Sarvangasana, so you have to make sure you do that. You don't have to go in 90 degree. You can take a support of wall like Anujaji and Rameji told us, and then you can keep it in maybe 45 degree. It depends on your body. So don't force yourself to go straight. Okay, so body straight, palms facing down. Inhale, move your legs in 90 degree, and then slowly push your body to go up. With the help of your hands, holding your lower back, it depends how much you want to go. Like I said, you have to make sure you keep here small towel or stop blanket to support your neck. That's important. Stay here for 3 to 5 breaths, and then slowly make sure your chin is touching to your chest. And that's called as, I think, Jalandhar Bandha, Assamiji.
Yes. And that is Jalandhar Bandha, yes.
Then slowly you come down. Take a support of your hand, slowly.
Keep your eyes towards the fingers or toe of your
Right.
hands.
Looking up, yeah.
Yes.
Keep up your toes. Come out, take the support of your hands, slowly.
Slowly.
And then one vertebra at a time, okay? Don't push yourself. Very gently, one at a time. Slowly, one vertebra at a time. We just said Om 1, Om 2, we just follow that.
Excellent.
Release and relax.
So yes, you have done excellent pose.
Very nice.
It is not easy for everybody, but just those who can practice it, they should practice with the support of props or the wall, whatever is good. And keep the support of your hands till your legs come down. Okay. If you give up your hands, then it may jerk your body. So so you have to keep the support of the hands till your legs come down and touch the ground.
For one adaptation of this, if somebody can go up, but they have difficulty coming down slowly, like you did very well, you came down slowly with your legs straight, spine, but you can adapt it. You can actually bend the knees and then come down. Then it won't strain your spine.
Yeah,
Is
that
that-
is possible. Yeah, you can bend. So the purpose of this exercise is to make the blood flow towards the brain,
Right.
neck side. So that's why it is done. But just we have to be very much careful for raising and also for coming down.
Really good. Well done, Dinesh. That's awesome.
Thank you very much. Thank you very much, Dr.
Yes.
Devendra, and thank you very much, Mandami. Thanks, everyone. Jai Jinendra.
Thank you. Thank you. Thank you. So, Suril Bhai, would you like to show some poses? Are you ready?
Not today, but tomorrow I will do.
Okay. Anybody else? Sheetal?
Vandami, I'm not ready today. I think Rakesh ji is ready, probably.
Okay, so Rakesh ji.
Naina's not feeling well, so she'll do it tomorrow, the after. She's got a little bit cold, so she's sleeping. So she was going to do it today, but she'll probably do it tomorrow, the day after.
Who?
Naina.
Okay. Okay, so since we have limited breathing exercise, so we can extend one more day for physical exercise, okay? So
And
those,
Rakesh is ready today. He can do some.
yeah, Rakesh, you can show.
I'll show a few lying down asanas.
Mm-hmm.
I'll start with the Apanasana,
Mm-hmm.
Uttan Padasana, and then Pavan Muktasana.
Correct.
Can you see me?
Mm-hmm. Yeah, you are completely visible.
So we'll first do Uttan Padasana and then transition into the Pavan Muktasana. And these are lying down asanas with poses. So slowly come into a lying down position. Okay. And then palms facing down. And then we'll do one leg at a time. So one 30 degrees and then 60 degrees. So right leg first. We start with the right leg. The toes facing forward. So we are stretching every muscle in our leg. Leg is straight. The feet are pointing forward. This is 30 degrees. Down. Left leg 30 degrees. Down. And then 60 degrees. Again, keeping the leg straight. Because of lack of time, we should hold it here for at least 30 seconds, but I'll more quickly. Slowly bring it down. Left leg 60 degrees. Hold it for 30 seconds. Slowly bring it down. Then we will do 90 degrees, which is Vipreet Karni. We can do this against the wall, but I'll try to do it without today. Again, bring both feet up 90 degrees. Keep them straight. Hold it. And slowly bring the feet down. And again, we can fold them to make it easy on our back. And then slowly straighten the legs up. Next, this is good for GI, our gastrointestinal disorders. Also look good for leg muscles. And anybody with back injury should not do this. Next is Apanasana. So for Apanasana, we fold one leg and press it against our abdomen. Straighten this out. Do the same thing with the leg. Straighten it out. Do it with both legs. We should hold it here for at least 30 seconds and do 3 rounds of each on a regular practice. We can also wrap our elbows around here, press them against our chest. So this puts pressure on the abdomen. It's very good for gastrointestinal disorders, constipation, and women's health. A natural follow-up of this is Pavan Muktasana. In that case, we lift our head and touch our nose to our knees, like this. Pressing our legs, knees towards our chest even more. And we can rock backward and forward as a variation of this. And then slowly bring your head down, unwrap your hands, and slowly straighten your legs out. Again, this is very good for stomach disorders and releasing any gastric disorders or abnormalities. Okay. I want to demonstrate the fish pose since we are lying down in this position. The fish pose is very good, again, for chest opening. It's good for asthma, also women's health, and generally good for blood circulation and respiration, increase our oxygen intake in our body. So in that case, we first roll to our left, put our right hand under our back, do the same thing with the left hand, and then slowly bring your body up, and then curve, open our chest all the way, pushing it up, and slowly lowering our head down, back, and just barely touching the crown of the head to the ground. Now our chest is open, our weight is borne by the elbows, not by the head. So the head is barely touching the ground, but our chest is open, our neck is stretched, so it's also good for thyroid. Stay in this position for at least 30 seconds. And then slowly straighten our neck, come up, and lie down one vertebrae at a time without any pressure. So this was Matsyendrasana, Matsyasana, fish pose. Do we have time, Samaniji, or is this it?
Now it is done. The time is up. So you have done excellent poses. All were very appropriate, and the technique was very good for making all these poses. So it was excellent actually. Okay. So just I was seeing my text Matsyasana. So since Anuja has taught like this, but sometimes we do with the lotus posture.
Oh, Supta Matsyasana.
Yes, Supta Matsyasana. So it may be called Supta Matsyasana.
Right.
Yeah. In Matsyasana, you are lying down actually. It is not that Supta Matsyasana is different, but just if you are doing with lotus posture, then it will give more what we say twisting to body.
Right.
So yeah, this is a kind of variation you can say. So good. So the rest of poses will be covered tomorrow by Suril and Sheetal and anybody. Shivani is not joining. Okay, so I will list all the exercise and maybe some of the exercise are missing because Anuja has taught some of the exercise which have been suggested. But just I am not having those names, but I will take from 9-11 and can 8. So you can see whatever is left, first we have to cover all those exercise and the same you can also repeat. Okay, so be ready for all the poses, Suril and Sheetal. So
Thank you,
Thank you,
Dr.
Vandami.
Yes,
Presentation.
thank you, thank you.
Very nicely done, Dinesh ji and Rakesh ji. Very nicely done.
Yes.
Vandami Namasami Samanichis.
Vandami namam sami samniji. Kritagya
Vandami
Smi.
namaste.